Good afternoon, bon après-midi à tous. Thank you for joining us for today's special media availability on the novel coronavirus COVID-19. Merci de vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19. Before we begin, I'd like to go over a few items. A reminder to please place your microphone on mute until I invite you to speak or to ask your question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located in the top right corner of the Zoom video screen. Merci de bien vouloir désactiver votre microphone jusqu'à que je vous invite à poser votre question. Veuillez changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de l'écran. Reporters with accessibility needs can pin the interpreters or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today we will be hearing remarks from Dr. Vera Etches. Notre porte-parole aujourd'hui est la Dr. Vera Etches, médecin-chef en santé publique. Je passe maintenant la parole au médecin-chef en santé publique. Please go ahead, Dr. Etches.
So thank you again. Good afternoon. Bon après-midi. The current testing situation in Ottawa this week has been challenging, and this isn't easy for anyone. I certainly hear the frustrations and I share them. We don't want to deter people who genuinely need to be tested with long wait times and the burden of having to manage childcare and work. And we don't want individuals to end up going to work or school having unknowingly transmitted COVID-19 because they didn't get tested. So our hospital partners are working incredibly hard to increase testing capacity in the city. I want to acknowledge the incredible heroic work of the hospital staff who are working the front lines of the testing site since they opened in March, having not let up, continuously finding efficiencies. We can't take away from that. You know, these are people who are taking time away from their loved ones, operating extended hours. They're here for us, and we appreciate that. And I am pleased by Ontario Health's recent announcement about the mobile testing sites in Ottawa. The 2 sites being piloted at 2 Ottawa schools today will help families and staff who've previously been identified as close contacts of someone who tested positive in the school environment, and then they're needing to follow up, not yet been tested. The Champlain COVID-19 Response Committee is working on more solutions like this. And I appreciate that evolving guidance has been challenging. So as Ottawa's doctor, my job is to provide clear guidance on who should be tested and who shouldn't. We're looking at ways to make this clearer through a variety of channels, not just social media or media availabilities, but on our website through infographics. And I'm relying on you still to keep getting this message out. It's not black and white, but there is a simple way. The simplest way I can put this is that Ottawa Public Health is currently recommending testing for those showing symptoms of COVID-19 or people who've been instructed by public health to seek testing. Santé publique Ottawa recommande actuellement un test de dépistage pour ceux qui présentent de nouveaux symptômes de la COVID-19 ou si Santé publique Ottawa vous a recommandé de subir un test de dépistage. There are a lot of what ifs, and so let me try to address those. If someone in your household becomes ill with symptoms, everyone in the household should self-isolate, but only the person with symptoms should be tested. Si un membre de votre foyer présente de nouveaux symptômes, tous les membres du foyer doivent être en isolement, mais seule la personne qui présente les symptômes doit suivre un test de dépistage. Others in the household do not need to be tested unless they have COVID symptoms or they've been instructed to go for testing by Ottawa Public Health. However, they do need to stay home until the original test comes back negative. If you or your child develop symptoms, including something like a runny nose, and you choose not to be tested for COVID-19, then you or they will have to stay home from work or school for 14 days. You should not return to school or work until you're symptom-free for at least 24 hours. Now, if you are contacted by Ottawa Public Health because your child is considered a close contact of someone else who tested positive, your child will need to self-isolate for 14 days from the time they were in contact with the person who has COVID-19. Your child should get tested after 5 days or as soon as symptoms appear. Si vous êtes contacté par Santé publique Ottawa à cause que votre enfant est considéré comme un contact étroit avec quelqu'un qui est testé positif, votre enfant devra s'isoler pendant 14 jours à compter du moment où il a été en contact avec la personne qui a la COVID-19. Votre enfant devrait subir un test de dépistage 5 jours après ou dès que des symptômes se présentent. Now, if your child does not have symptoms, other members of the household do not need to self-isolate unless they have symptoms. And if there are siblings without symptoms, they can go back to school or they can go to school as usual. If you receive an emailed letter from your school, the children's school, because someone who works or attends the school tested positive, there's no further action required if you don't then hear further from Ottawa Public Health directly by email or phone. Because we give a first letter by email that's to everyone in the school, that there's someone in the school who's tested positive. That letter does instruct that if you don't hear from Ottawa Public Health further in another emailed letter or by phone, then that's it. There's no further action you need to take. Si vous recevez une lettre par courriel de l'école de votre enfant, parce qu'une personne qui travaille ou fréquente l'école a reçu un test de dépistage positif, aucune autre action n'est requise si vous n'êtes pas contacté directement par courriel ou par téléphone par Santé publique Ottawa. Your child can continue to attend school and does not need to be tested unless they're instructed to do so by Ottawa Public Health. In the event of a school outbreak, the same follow-up recommendations would occur. Ottawa Public Health will tell you specifically if you need to self-isolate or seek testing. I know there will continue to be a lot of questions, so we're working as best as we can to provide answers. I do encourage people to continue to use our website. We are trying to address the questions that are frequently asked, and we continue to evolve our COVID-19 page, especially around information with schools. And so I'm open to address any other questions that the media may have, and certainly thank you again for your role in communicating these messages.
Thank you, Dr. Etches. In the interest of time, I will read through the list of media who have registered. No need to indicate if you are present. However, if I missed your outlet, please speak up after I am through the list. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas nommé votre agence. 1310 News, blog on the city from the burbs, CBC Ottawa, CTV News, Global News, Le Droit, Ontario Français Plus, TFO, Ottawa Citizen, Radio-Canada, Rogers TV, Toronto Star, TVA Gatineau Ottawa. Have I missed an agency? Est-ce que j'ai manqué quelqu'un? Great. I will now invite each agency in alphabetical order to ask their question. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. We'll now start with 1310 News. Please go ahead.
Hello, this is for Dr. Etches. How long of a second wave do you anticipate, even though it's hard to judge, but compared to the first wave, if you will?
Sure. So what I'm seeing when I look at our data is that, well, and what I hope is we can be in a series of peaks and valleys when it comes to the level of COVID in our community. So after the first wave, we had a little peak in July where the actions of everyone were able to decrease transmission in the community after a bit of a rise. What I'm hoping to see now, as we're in a greater rise, is not that it would turn into a large second wave, but it would be another peak where we increase the distance between each other, we limit our contacts, and it comes back down, quickly. The actions we take today could make that wave flatten, that curve flatten again within the next 2 to 3 weeks. So that's what I hope, is that this is another peak that will not last longer than the next 2 weeks. And it is up to each of us to make that happen.
And for those who are in lower income environments who even if they can't socially distance or whatnot, are they, do you feel they are the ones who might be at more risk of exposure? Like I'm talking about those who are working, like frontline workers at grocery stores and etc.
What we know is that there have been changes in workplaces that are providing protection to people. So using masks and keeping as distant as we can in workplaces does help. We don't have large workplace outbreaks where those practices are in place. What we do see is some challenge when people are in living environments where it's hard to self-isolate, that if one person in the household develops COVID-19, it can lead to others. That's why we're looking right now at how to make other options available for people to self-isolate if they're having difficulty in their home. And there are tips on our website about how to self-isolate in your home, but we know it's not an easy thing for everyone. And so we're looking at additional options for that.
Thank you so much.
Thank you. Up next, we have Sue Sharing with Blog on the City from the Burbs. Sue? All right, we'll go to who's next on the list, CBC News, Sarah Kester. Please go ahead, Sarah.
Hi, thank you. Dr. Etches, earlier today, Premier Doug Ford said, people who are asymptomatic are getting anxious, they want to get tested, and God bless them, go get tested. I know you just laid out sort of who needs to get tested in Ottawa. Is this sort of a mixed message situation?
I really appreciate the Premier's approach, that everybody who needs access to a test should be able to get access to a test. What I'm trying to clarify is that it's not always useful.
There he is. Hi, my friend. How are you?
Oh, sorry. I hear
sorry. I'll unmute myself.
Yeah. So I appreciate the Premier's approach that anyone who needs a test should be able to access it. And what I see, my role is to clarify when is that test useful. And for people who are asymptomatic, it's not always useful because you could have the infection and not yet be at a level where the virus is detected by the test. And if you're thinking that it's sort of a way to know that you're good to go for a party on the weekend or something like that, a visit to grandparents, it's also not a guarantee because you could also be exposed to the virus between when you got the result and when you do the visit. So we really need to rely on our behaviors to stop transmission of COVID. We need to keep distance of 2 meters between others and wear a mask when we're indoors. That is what will make it unlikely that we transmit or pick up the virus. And so really then focusing on those who need to be tested where the test is useful when they have symptoms to rule out the COVID is causing the symptoms, and where people are close contacts to make sure that there hasn't been transmission in those environments.
Oh, really? Right. And my follow-up is, what exactly defines a second wave? Why are we in one right now?
So the idea of a wave is that the number of COVID, tests that are positive, the number of people who are carrying the virus in our community is growing. So we see an increase in the number being detected. We know that number that's detected is always, going to be dependent on the proportion of people who come forward, and it's not the whole picture. But we have other clues besides just that number that suggest we have more COVID happening in our community. It's the percentage of people that test positive that's growing, even though the number of people who are getting tested is really growing as well. So there's these signs that there's more COVID in our community. That's a wave. And the challenge comes when that growth is too rapid and if it's sustained. So if we see this rise in infections growing quickly, it could get into long-term care homes more. It could cause more hospitalizations and more deaths. And we really want to avoid that. Our goal as a community is to stop the rise, slow down the rise, turn the curve again, which we have. And so, keep it at a smaller peak in the wave, and that will help us get through and continue to manage to live with this virus.
Great, thank you, Dr. Etches. Up next, we have CTV News Ottawa, Josh Pringle. Please go ahead, Josh.
Thank you very much. Dr. Etches, the mayor said twice this week that he has heard as many as 90% of people at the testing sites have not had any symptoms and don't need to be there. Do you have any idea on how many people are showing up at these sites that don't need to be tested?
Our testing partners that run the system are trying to collect that data to show, what the demand is between people who are symptomatic and asymptomatic, and what's happening children versus adults. There is a difference between children and adults. So I think the higher proportion, 90% of adults, that's where that's coming from. It's more the adults that are asymptomatic that are showing up in larger numbers. When it comes to the children, the majority of them do have symptoms. That's why parents are bringing them. The parents are trying to do the right thing, and I really appreciate that. This is a hardship right now to have to stand in the lines, and we need to address that. But most of the children going are symptomatic, not all of them, and that's why I'm trying to clarify, especially within a household, it's only the child that has symptoms that needs to be tested, not all of the other children.
My follow-up question, the drive-through testing center is full this weekend. The Brewer testing site is now the only site available for testing over the weekend. What's your advice to people who are thinking about going to get tested or need to get tested? Do you have any advice for them heading into the weekend?
Well, there will be more capacity at the Brewer Center. So the mobile sites that we had, one of them can be relocated to the Brewer site to add some capacity, as well. Other staff are being added. This is my understanding. I think you'll have to verify the details with the operators, but my understanding is it is a Brewer Plus expanded capacity this weekend.
Thank you.
Thank you. Up next, we have Craig Lord with Global News. Please go ahead, Craig.
Thanks very much. So Dr. Etches, when you met with Doug Ford today, what did you tell him is the most effective thing the province could be doing right now to help the situation in Ottawa?
Well, I thanked the Premier for taking quick action to address the size of social gatherings. I think that is probably the most important thing, is for all of us to get the message that we need to limit the number of close contacts we have, and smaller gatherings are better. Really, if you can keep the close contact to your household and just those who are essential, for childcare or grandparents or neighbors that matter. I think we have to go back to the distance when we're visiting with others, ideally outside. So he responded to that request for support on that messaging, and I appreciate that. We're also concerned, he shares as probably one of his top concerns is about access to testing. And so, that's certainly something where, we're looking for the rapid growth and capacity to keep up with demand. The Premier and I also spoke about long-term care homes because we want to make sure that long-term care homes have the adequate staffing in place to be able to manage, to do the infection prevention and control and cohorting actions that are required when someone tests positive in a long-term care home to stop further transmission. So these are the things that are top of mind.
And just as a follow-up, we've seen the virus now in about 18 schools in Ottawa over about the first 2 or 3 weeks of school. How are you evaluating how well the return to school has gone so far in Ottawa? Is this about where you were expecting it to be, or what's kind of your grade for it so far?
I'm thankful that we are able to, work well with our school boards and our principals. I think the process to notify parents is going fairly smoothly when someone does test positive in the school environment. We always would like to make sure if people can be screened out that they are, and so a reminder to all parents out there, myself included, the daily check of children before they go to school to make sure they don't have symptoms is important. Same with teachers and staff. I think that we did expect that there would be people in the community who acquire COVID, who might not realize it and bring it into the schools. And our goal is to stop it there so that we can send home any close contacts and make sure that there's not spread within the school environment. So these processes are rolling out. People are going home on self-isolation to limit the exposure past that initial identification of the first person testing positive. I guess what I'd like to see is that there were lower rates of COVID in our community. If we can all do our part, I'd like to see less introduction of COVID into the schools, and that's really where it starts.
Thank you, merci. Nous passons maintenant à Julien Paquette avec le droit. À vous, Julien.
Bonjour. Dr. Etches, avec la capacité qui est insuffisante en ce moment pour le dépistage à Ottawa, je me demandais si vous aviez des chiffres à votre disposition concernant des résidents du Québec qui seraient insatisfaits de la rapidité du système au Québec et qui viendraient se faire tester à Ottawa plutôt. Est-ce que c'est le nombre de résidents du Québec qui sont venus faire leur dépistage à Ottawa a augmenté dans les dernières semaines?
Je comprends que nous sommes une communauté, les deux côtés de la rivière à Ottawa et Outaouais-Gatineau, qui est vraiment ensemble une communauté. Il y a des gens qui habitent à un côté et travaillent à l'autre. Et oui, je pense qu'il y a des gens qui viennent de Québec qui utilisent le système pour le dépistage ici à Ottawa, mais je n'ai pas les chiffres. Peut-être nos partenaires qui gèrent le système pour le dépistage à les numéros, les chiffres, mais je n'ai pas. C'est souvent qu'on a une investigation qui concerne les deux côtés de la rivière. Alors, c'est important d'identifier les personnes avec le virus et travailler ensemble pour faire le suivi.
Parfait. Et donc, j'imagine que vous n'avez pas nécessairement non plus une idée de s'il y a une facture qui est envoyée au gouvernement du Québec pour des résidents du Québec qui se font tester à Ottawa?
Non, je ne sais pas. Je n'ai pas entendu un plan pour une facture.
OK. Merci beaucoup.
Merci, Julien. Nous passons maintenant à Pascal Vachon avec TFO. Pascal, à vous.
Oui, bonjour, Mme Etches. Ma question pour vous, c'est votre collègue dans l'Est ontarien, Paul Roumeliotis, le médecin en chef, a dit qu'il aimerait que sa région à lui soit aussi inclue avec Peel, avec Toronto et Ottawa pour limiter les rassemblements extérieurs. Fait que ma question, je voulais savoir, est-ce que vous êtes d'accord avec lui, parce qu'il y a une proximité avec Ottawa, bien entendu, et est-ce que vous avez parlé avec le docteur Roumeliotis de cette possibilité-là?
Je pense que vous voudrez savoir si c'est bon avec moi l'annoncement concernant les rassemblements et de diminuer le nombre de personnes à l'intérieur, par exemple. Et oui, c'est important. C'est important de réduire le nombre de contacts étroits dans notre maison. Mais je pense que vous avez aussi une autre question, je n'ai pas compris complètement.
Oui. votre collègue Paul Roumeliotis, dans l'Est ontarien, le médecin en chef, a dit hier qu'il aimerait peut-être que sa région à lui, que l'Est ontarien soit inclus avec Ottawa, avec Peel et avec Toronto pour limiter les rassemblements. Alors, je veux savoir si vous
oui,
parler de
ok.
ça avec lui, puis est-ce que vous seriez d'accord d'inclure l'Est ontarien dans les mêmes restrictions?
Ok. Oui, je comprends et oui. C'est difficile d'avoir une ligne exactement pour déterminer qui est un résident d'Ottawa ou un résident plus à l'Est. Nous sommes vraiment aussi connectés et alors je comprends son demande et j'apprécie son intérêt d'avoir une approche similaire.
Et finalement, comme question de suivi, je voulais savoir, est-ce que vous attendiez à une telle, vous avez parlé ce matin qu'on rentrait dans une seconde vague. On est présentement le 18 septembre, ça fait 2-3 semaines que les écoles ont commencé à Ottawa. Est-ce que vous attendiez à ce que vous rentriez si tôt dans une seconde vague ou est-ce que c'était quelque chose que vous prédisiez déjà?
Le deuxième vague, si on veut utiliser cette phrase, ce n'est pas à cause de la réouverture des écoles. C'est notre action à la fin de le mois d'août qui a créé cette augmentation dans le COVID-19 dans notre communauté. Et c'est vraiment notre action avec nos proches, nos familles, le rassemblement social, c'est où le COVID-19 a augmenté. C'est pas à cause de les écoles.
Okay, thank you. Up next, we have Andrew Duffy with the Ottawa Citizen. Please go ahead, Andrew.
Hi, yes, I was just wondering if you could help me understand what is the biggest impediment to increasing the amount of testing in the city? Is it is it staffing? Is it finding a site? Can you help us understand that?
I think that it's probably worth talking more to the people who are running the system, but certainly when I'm in conversations with them about how to increase capacity, it definitely comes back to staffing. I know they are looking for more sites, and I know that they keep learning, they keep becoming more efficient at the sites they have. The booking system has worked well at Coventry. I know they're looking to expand the booking system to decrease the stress of being in line. There are a lot of things that are underway. And as I say, I think today there was more capacity out there. I think, on the weekend, there's additional staff that are continuing to be added. The hospitals initially staffed with people who are now needing to be back in the operating rooms. So it is a matter of trying to find additional personnel for sure.
And do you have any sense as to how you do that? I mean, how is that going to be accomplished?
My understanding is they are hiring and they're looking to hire paramedics, especially that can be available, for mobile solutions as well as add to the site. So this is something they're working on urgently.
Thank you.
Thank you. Nous passons maintenant à Jean-François Poudrier avec Radio-Canada. À vous. Jean-François? All right, up next we'll go with Kate Allen from the Toronto Star.
Oh, sorry, désolé, j'avais pas le micro. Allô?
Oui, bonjour.
Oui, excusez-moi, j'avais pas enlevé mon mute. Donc, oui, vous avez parlé en anglais un peu au début de cette question-là, mais pour quelle raison vous dites maintenant officiellement qu'on est en deuxième vague? Qu'est-ce qui explique ça selon vous?
C'est pas compliqué. COVID est transmise quand nous sommes proches aux autres, quand la distance entre eux est moins de 2 mètres et nous n'utilisons pas un masque à l'intérieur. Alors, c'est vraiment parce que nous avons un peu relaxé dans les situations sociales avec nos proches et le nombre de contacts étroits est agrandi.
Mais pourquoi vous dites pourquoi vous dites maintenant on est en deuxième vague? Quelles sont les raisons?
Parce que nous avons eu plus de contacts étroits. C'est pourquoi.
Mais qu'est-ce qui vous fait dire pourquoi là on est en deuxième vague et non pas, est-ce que c'est le nombre de cas, c'est le nombre de... Comment on peut...
OK. OK, c'est indifférent. OK. Oui, on utilise la ligne, la courbe concernant le nombre des cas. Et il y a la première vague en juillet, on a aussi une petite montagne. Et maintenant, ça continue d'avoir une augmentation encore. Alors, c'est comme on veut avoir les petites montagnes, pas une grande vague. Mais c'est la courbe concernant le nombre des cas qui est juste une partie de la COVID-19 dans la communauté, mais ça donne l'idée, on peut voir qu'il y a plus de COVID aussi quand on voit le pourcentage des dépistages qui sont positifs. Cet pourcentage aussi augmente maintenant. Ça indique qu'il y a plus de COVID dans notre communauté.
Et quelle est votre recommandation pour les garderies, les centres de la petite enfance, pour recommander des tests aux enfants? Parce qu'en ce moment, il semble y avoir différents niveaux de demande. Certains disent de ne pas faire tester leurs enfants à la garderie, certains disent de les faire tester absolument. Quelle est votre recommandation? Et je ne sais pas si vous pouvez le dire en anglais aussi par la suite.
Oui, mon recommandation pour quand les parents ont besoin d'aller trouver un dépistage pour leur enfant dans les garderies, c'est le même pour toute la population. C'est quand il y a des symptômes de la COVID-19 et aussi quand Santé publique Ottawa recommande un dépistage parce que quelqu'un est en contact étroit avec quelqu'un qui a un dépistage positif. So for children in daycares, the advice about when children in daycares should go for a COVID test is the same as for the general population. And that is, if children in daycares have symptoms that could be COVID-19, and the list of symptoms is in our screening tool for schools on our website, or if public health says that they've been in close contact of someone who tested positive.
Merci.
Thank you. Up next, Kate Allen with the Toronto Star. All right. Nous passons maintenant à TVA Gatineau, Ottawa. À vous. All right, well, that's all the time we have for today. Thank you all for joining us. Ceci conclut le point de presse d'aujourd'hui. Thank you and have a nice weekend.
Merci tout le monde. Thank you.